Welcome to Precision Neuromuscular Therapy for the Spine and Thorax. This video clip is meant to show you ways that you can integrate the techniques that you learn in the seminars into your treatments every day in a very effective and very easy way. Jan Kiener, one of the PNMT instructors, is working with her clients, integrating now the assessment techniques before the session. She's palpating the PSIS. Now she will have the client, she's demonstrating the Sideline test, and she'll have her lift her knee to her chest. First on the right, monitor movement of the PSIS, and then on the left, and monitor movement of the PSIS. And then easily transition into the QL test bilaterally, notating what she finds. The testing clarifies for us which muscles are involved and also gives us a benchmark to know the effectiveness of the muscles that we have chosen to treat. This is the case using the tape measuring spinal flexion. Post-treatment, we'll re-measure again and see the effectiveness. If we've done a good job, spinal flexion should increase. This is the standing flexion test. And now we're ready to transition on to the table. With a bit more testing, here's the Faber test. Looking for discomfort either at the SI joint or at the groin, which might indicate some possible involvement of the hip. So Jan will do hip range of motion. First flexion, which seems to be fine. Internal femoral rotation. External femoral rotation. Now the Lessegs test. Crossed Lessegs. And we're ready to do some soft tissue work. First with some fascial mobilization, and then Jan is actually going to do the sacral traction, monitoring the movement of the sacrum during the respiratory process. This is a slow process of taking in information, not moving quickly. Again, Swedish style motions can be added as a segue in between each specific technique that we do. They become sort of the matrix with which you can blend techniques. So she goes from general to now very specific. Isolated treatment now of the iliocostalis on about the 10th rib. First she's located it and then is treating it with a superior inferior motion. Each rib attachment is truly a different muscle. One of the things that I want you to pay attention to is the speed at which Jan is working, and also the depth that she's working. Notice it's not really deep, yet to the client on the table it feels very engaging. It's about being very precise and very thorough. It's always about precision, not pressure. about focus and location, not so much about depth. Now Jan is doing very specific treatment of multifidi, looking for mammillary process attachments, being very thorough. She'll move from mammillary to spinous process attachments at every vertebral segment in the lumbar spine, treating multifidi. Notice as she goes in to a deeper area, she's going to make that entry very soft. The deeper you go, the slower you go. Now she will treat the attachment of the multifidi on the dorsal surface of the sacrum. Thumb over thumb, supported thumb position, making it very easy on her hands to do that. Again, notice how she's moving from one little area to the next. She's checking in with her client to find any areas of exquisite tenderness, and then moving back and forth. Blending a little motion in. Now treating the iliolumbar ligament. Very deep structure, so again she's moving very slowly, really being clear about the anatomy that she's trying to affect. Now the spring test of the thoracic spine, looking for areas that don't have the same elasticity as other areas. Pressure against the spinous process attachment of rotatory. Moving to the transverse process attachment, treating the medial aspect of the transverse, and then to one segment below, treating that transverse process. And then repeating the spring test to gauge the effectiveness of the work that she's done. Here you see the sideline myofascial work that we did on Saturday in the seminar. Notice how wonderful that looks, how easy, how soft, how playful, yet very focused, very precise, and very effective. This you can do on somebody who has a lot of tenderness and soreness in that area, because it isn't so direct and so penetrating. We like to call this flying under the radar, doing work that doesn't engage their defenses. Notice the movement that she's doing of the whole pelvis. All of this will stretch and open all the lateral flexors on the right side, including their attachments on the lower ribs. She can treat the QL attachments, both transverse process attachments on the 12th rib. Treat the serratus posterior inferior in this position, the internal oblique And after all that treatment, she will re-measure to gauge the effectiveness of her work. She knows what she treated, why she treated it, and where we'll go in the future.